Hey, Charlie, good morning.
Hey, good morning. How are you?
Doing well. Thank you for agreeing to pinch hit for Chairperson Burke today.
My pleasure. I'm glad I'm able to do it.
And I should have an answer on the other issue that we have been discussing relatively soonish.
Right.
Meeting Thursday, and then I'm taking off for vacation after that, so I don't know if it'll be resolved. If it's resolved immediately after that meeting, I'll try and let you know before I get out of town. Otherwise, it'll be when I get back.
Great. So where are you going diving?
The Bahamas. We
Nice.
Yeah, we try and get out. We'll be staying at one of those sandals because they give this free scuba diving when you go to those places. So we can't turn that down.
Yeah. Have you ever?
Wait, you get free scuba diving there?
Yep.
Good to know. Thank you.
I'm sorry, Josh. How are you, Josh?
Good. How are you, man?
I'm great, thank you. Have you ever gone to Turks and Caicos to dive?
Absolutely. I was there last fall, and I'm booking 2 Turks and Caicos trips probably when I get to the Bahamas at the beaches there. Last time I was there in the fall, I've got some great videos of some sharks swarming me.
Yeah, it's one of my favorite spots, and it's such an easy flight. Like the Bahamas is a bit, but it's such an easy flight in and out of there.
Yep, my wife and I are going to try and go every September to Turks and Caicos. I'm a member of the Sandals program, and they get really good discounts if you go to the beaches in September. So.
Oh, that's great. I love it there.
So we had a little problem with the password. That was a new thing, and thank goodness Josh flagged it for us early enough. So hopefully people will be able to find it.
Fingers crossed. Fingers crossed.
Yeah.
Yeah. Those passwords. I mean, like, I don't know, like, how you decide to make those, like, but those are uncrackable. Someone like guesses that. I mean, God bless them. That's what I say. Like, that's crazy.
Well, hopefully now that I know we need a password, I can look and see if I can change it to something that's a little more user-friendly.
That will be terrific.
Greg, do you want to go around the room when we start to introduce everyone, or just do the intro and jump into the meeting since it's a pretty full agenda?
You know, I'm thinking maybe we could jump in at first because I think some people are probably going to be a little late getting on. To see our first presenter doesn't appear to be on yet, but I see somebody with the same last name who's in on the public one. So I just want to make sure we might be able to bump them if that's the right spot. Oh, yep. So there's somebody named McGrath that's in the public waiting room. So yeah, I don't know if that's Kathleen or something. Okay, thank you.
Hi, this is Josie from OPWDD. I just want to ask Kathleen, are you a panelist? If you are, you're muted. So if you could unmute and just let us know.
All right. Hi, good morning. Katie, is that the preferred name? You're muted.
You're muted.
Good
Very
morning. Good morning. Nice to see you. Thank you.
nice to see you. Thank you. Thank you for joining.
Of course.
And we're excited to hear about your report. Of
Okay.
course, I've read it a couple of times, but I think this is good stuff for the public to know. And I know Michael Gilberg will be joining a little bit late, but maybe just a few minutes. So Josie, were you going to do the traditional kickoff when we go?
We can. Looks like we don't have very many people, but you
No.
want to get started?
Why don't we start in like 2 more minutes? Michael Gilbert will be on at 10, or he'll be joining at 10. So that's one person who's won't be right away.
Hi everyone, I'm Josie from OPWDD, and before we get started, I just wanted to give a few housekeeping notes to mention. First, I want to apologize to everybody about some confusion with getting in today's meeting. We're using a new software that's just slightly different than we've used in the past, and it's just different enough to make it a little inconvenient. So we apologize. I also want to let everyone know that we have closed captioning going. If you'd like to access that service, you'd look in your bottom right-hand corner to the multimedia viewer, at which point you're going to see a drop-down menu. And you can choose to have the closed captions in either English or Spanish. We also offer sign language interpreting. For that, you just want to find the panelist and pin them, and you can watch the meeting in sign language.
All right, so I guess I'll kick it off. Good morning, everyone. Our chair, Courtney Burke, unfortunately couldn't make it today, so I'll be stepping in. My name is Charlie Massimo. I've been part of the board since its inception and happy to be able to fill in this morning. It's a pretty full agenda, and after today's presentations and board discussions, there will be an opportunity, as always, for public comment. So I'd like to just go over the agenda quickly and we'll jump right into it. So first, we're going to have a presentation and board discussion on the exploratory spatial analysis of autism rates in New York school districts, role of socio-demographic and language differences, and that'll be given by its author, Kathleen McGrath. We'll then follow it up with a presentation and board discussion on the very important OPWDD's 2023 to 2027 draft strategic plan. And that presenter will be Dr. Jessica Pidgeon. And then we'll have a brief update from Greg on one new law that's passed this year that will directly affect each of us on the board. Then Alexia Holden will talk about the new neurodiversity flag, which is the contest idea and next steps for the board to take it on. And that's a pretty exciting advancement from recent or past discussions that we've had. And then Alexia will also be talking about the meeting formats going forward for the board. And then we will open it up to public comment. So again, our first presentation is linked to a new law passed and signed by the governor that directs the board to review the research report titled Exploratory Spatial Analysis of Autism Rates in New York School Districts, Role of Socio-Demographic and Language Differences. And our presenter is the author, Kathleen McGrath. Katie serves as a senior research coordinator for the Rose F. Kennedy Children's Evaluation and Rehab Center at Albert Einstein College of Medicine. In this role, Ms. McGrath collaborates with RFK CERC clinicians and trainees on all phases of clinical, translational, community, and advocacy-oriented research. Research and community initiatives typically center on intellectual and developmental disabilities, as well as pediatric health and development. Ms. McGrath received her Master's of Social Work from Bryn Mawr College, Graduate School of Social Work and Social Research in 2014, and is currently pursuing a PhD in Social Welfare Demographic Research from Hunter College and a Master's of Public Health from CUNY Graduate School of Public Health and Health Policy. Her current research areas include demography and public health, pediatrics, social medicine, children's environmental health, and geographic information systems. Well, Katie, it seems like you're really not doing enough. I don't know. You got to fit some other things on your plate. So really excited to have you here this morning and hear your research and findings on this report.
Thank you so much. I'm very grateful to be here today. I'm going to be reporting on a recent study from 2020 entitled Exploratory Spatial Analysis of Autism Rates in New York School Districts. So just share my screen. Sorry, just having some trouble sharing my screen. Let's see.
Let's see if we can put it up.
Do you want me to try to load it on this end?
Sure, if you don't
I'm
mind.
not-
Sure,
I'm not sure if it's going to work, but let's give it a try.
Thank you. Thank you.
Is it working? Can you guys see it?
Okay.
Yes. Yes. Thank you so much. Thank you. Okay, great. Yes. So the title of this research report is called Exploratory Spatial Analysis of Autism Rates in New York School Districts, the Role of Socio-Demographic and Language Differences. Just a little background. As I'm sure you all know, autism spectrum disorder is defined by the DSM-5 as a developmental disability characterized by persistent impairments in social communication, repetitive behaviors such as rocking or hand flapping, and restricted interest. The prevalence of ASD has increased globally over the past several decades. This is a result of both increased prevalence of ASD as well as increased awareness and diagnosis among health and educational professionals. Is it possible to go to the next slide? Oh, thank you. Oh, thanks. ASD is characteristics can be detected as early as 18 months. According to the CDC, a diagnosis at the age of 2 is considered reliable. However, 85% of children with ASD have parents who expressed developmental concerns as documented in medical records before the age of 3. So this was something the CDC published and just suggests the importance of parent report in noticing developmental concerns before the age of 3. Currently, the average age of ASD diagnosis for children in the US is 4 years and 4 months old. Historically, there have been racial and ethnic gaps in diagnosis with white children being diagnosed at earlier rates than Hispanic and Black children. However, that gap has been closing, but I'll discuss more of that later. But historically, there has been a lag in diagnosis among different racial and ethnic groups. Next slide. Thank you. Historically, there has been limited data available on disabilities. And according to the World Health Organization, this is particularly true in developing countries, but also just nationally in the United States. Many U.S. disability statistics come from the U.S. Census, and the U.S. Census categorizes disability by functional impairment, such as cognitive impairment, visual impairment, hearing impairment, and mobility impairment, but does not necessarily provide associated diagnosis or condition. Increased disability surveillance efforts, particularly on a national level, are warranted. Data on autism in the US is typically available from 4 primary sources. The first is the CDC Autism and Developmental Disabilities Monitoring Network. And this is a project that was started in 2000 and has been growing and expanded to 14 clinical sites. Unfortunately, New York is not one of those sites, but these are data that are obtained at age 4 and 8 years old among children with autism. The second source, which I use for this report, is the Department of Education IDA data, and these are children enrolled in school districts. And this data is available at the school district level. And lastly, there are 2 national surveys which collect information on disability. The first is the National Survey of Children's Health, and the second is the National Survey of Children with Special Healthcare Needs. This is a nationally representative parent report survey of U.S. children, and the estimates from these surveys tend to be slightly higher than the ADD data. Next slide, please. Thank you. This is just a map which shows the site locations of the CDC's ADDM network sites as of 2018 and 2020. And the purple shows tracking autism among 4 and 8-year-olds, and the blue highlights follow-up to teens up until age 16. Next slide. The research study aims for this project, the overarching purpose is in the study, we wanted to explore socio-demographic and geographic variations among English language learner students and students with autism spectrum disorders between pre-K and grade 12 in New York State. Underneath that overarching aim, more specifically, we wanted to spatially explore ASD prevalence in New York State, utilizing data from school records. And our second aim was to identify differences in ASD prevalence between ELL students and native English-speaking peers, along with socio-demographic characteristics for each group. Next slide, please. This project, we use 4 primary data sources. I've included the links here. These are all publicly available data files. The first 2 are from the New York State Department of Education. They have a great data portal with information on the New York school districts and different IDEA data. And also, I use the New York State Geographic Information Systems Program Office to get a boundary map of New York State school districts. And lastly, the United States Department of Education IDEA Act data. Next slide. For the initial part of our methods, the data conditioning and transformation. First, school data files were obtained from the DOE for the 2016-2017 academic year. School districts with small populations, less than 150 students per district, were not included in the analysis. There were a total of 11 school districts that were removed. This was mainly decided because of the small student size, that the percentage of ASD and ELL status for these districts could be potentially misleading. A total of 31 school districts were missing population sizes in the original data, so these were obtained separately and entered manually. Student populations were obtained from a separate DOE data set so that percent ASD, ELL, sociodemographic variables, et cetera, could be calculated per school district. Once the data was ready, we then imported it into ArcMap and merged via spatial join to the New York School District shapefile to create a map. Next slide. I'll try to go through this pretty quickly, but For our data analysis, essentially we created a few maps, and then in addition to understand sort of the role of sociodemographic variables, we also conducted some regular statistics. So the first section, we conducted descriptive statistics showing sociodemographic characteristics of school districts stratified by ELL status. These summary statistics for all school districts, show a total of 895 school districts in New York State, were calculated in ArcMap and stratified into tertiles, so low, medium, and high. We also reversed it and categorized sociodemographic characteristics of school districts based on ASD rates, the 3 categories as well. We also completed OLS a traditional regression, both a univariate and multivariate linear regression of variables predicting ASD prevalence in New York school districts. This we completed in our statistical software. Next slide. Our first map shows, which I'll show shortly, shows the percentage of students with ASD in New York school districts. This was created using ArcMap software. Data was classified into 5 intervals and then created into a monochromatic, varying shades of one color, map of autism rates. And we also did the same for percentage of ELL students in New York school districts. We also completed, just to visualize, an age distribution graph of autism students with autism in among New York students in the 2016-2017 academic year. And as statistical tests, we also, a spatial statistics test, conducted a spatial autocorrelation of autism and ELL rates. It also conducted that in ArcMap. And lastly, just as an extra verification step, we also completed an ASD and ELL map showing standard deviations below and above the mean. Next slide. So our main findings, and I'll go into these in a little more detail, but in contrast to prior research on ASD prevalence among minority groups, we found disproportionately higher rates of ASD among Black and Hispanic students in New York State. Geographic analysis revealed statistically significant clustering of school districts with high autism rates in New York City and Albany. This is consistent with other research studies that have shown associations between urbanicity and ASD. So there was a large study in Taiwan and also a Danish cohort study, I believe of 800,000 children that have also shown a clustering of children with autism in urban centers. So our findings were consistent for New York State with that as well. We also found that English language learner students tended to be concentrated in densely populated urban and geographically smaller school districts and had higher percentages of Black, Hispanic, and Asian students. So in summary, schools with higher rates of autism and English language learner students tended to be concentrated in urban regions throughout New York. These regions have higher representation of Black and Hispanic students, as well as higher rates of learning disabilities in general, which we were surprised to find. Next slide. So our descriptive analysis of school record data for all New York school districts revealed an average autism rate for New York State of 1.1%. and an ELL percentage of 2.6%. So our findings on ASD prevalence in New York are generally consistent with national prevalence rates, which generally fall between 1% and 3%. This was from 2016 to 2017. The numbers do change often, but we did find that for that year they did match the range of the national autism rates in the United States. Districts with the most English language learner students had slightly higher rates of autism than the statewide average, small, less than 1%, 0.12% and 0.49% respectively, and a greater composition of Asian, Hispanic, and Black students, 3.7%, 12.7%, and 7.2% respectively. So we did find that the percent of ELL students in New York is considerably lower than the national average for US public school districts during the same year. And I believe for that year, the highest percentage of ELL students are located in California. And correlations between socio-demographic variables and ASD rates were fairly weak. However, moderate correlations were observed between autism rates and percent of students with reported emotional disturbance. That's an IDA category that the school district data provides, and also that there are moderate correlations between autism and students with disabilities, as was reflected in our findings. Next slide. So this was one of our summary statistics tables. So this shows in the first column for all school districts, the mean percent of autism spectrum disorders as 1.1 and English language learners as 2.3. And among school districts with the highest rates of ASD, which is seen in the third column on the right, there are approximately 4% less white students, 2% more Hispanic students, and 2% more Black students than the state average. And we also found there were 2 to 4% more economically disadvantaged students in these school districts. School districts with the highest rates of autism also had 3% more students with IDEA identified disabilities. So generally we found these characteristics sort of hanging together. Next slide. So this shows the autism rates per school district. So these are percentage per school district. So the darker shades indicate a higher percentage. And as you can see, the clustering of school districts with high autism rates were generally observed in the New York City metropolitan area and also Albany. Next slide. This map shows percent of English language learners per school district. And these were concentrated you can see the darker shades at different, these weren't as, English language learner students weren't as clustered around New York City and Albany. Alone, that we have found actually that English language learner students were more spread out throughout the state and generally in more urban and geographically smaller regions of the state. So we found ELL students are concentrated around New York City, Long Island, and other urban regions, cities of the state. with the exception of a few rural and suburban school districts, which were outliers. It appears that school districts with high ELL concentrations are geographically small, urban, and densely populated. Next slide. And this was the spatial autocorrelation test that we completed. And this essentially just confirms that those clusters we saw on those first two maps weren't due to chance. Spatial autocorrelation tests fortunately did reveal that clustering was in those of ELLs. Students were statistically significant in the New York City metropolitan area and Rochester. In regards to autism, statistically significant autism clusters were seen within the 5 boroughs of New York City, Albany, and the region immediately south of Albany. Next slide. This graph is the age distribution of New York students with autism for the 2016-2017 academic year. And the number of students with autism are lowest among those aged 3 to 4 and 18 to 21 years old. And the majority of students with ASD are typically between 6 and 15 years old. Next slide. So our main findings, schools with higher rates of autism and percentage of ELL students tended to be concentrated in urban regions throughout New York and have higher representation of Black and Hispanic Latino students, as well as higher rates of learning disabilities in general. The findings from this study are intended to provide a snapshot into the socio-demographic composition and geographic distribution of ELL students and students with autism in New York. We were surprised to see overall higher rates of disability among school districts in New York with greater proportions of minority students and students of lower socioeconomic status. So this may actually be a good sign for New York that that racial gap is not present in New York State. This could potentially indicate greater awareness of or training in learning disabilities in high-need school districts in New York State. Also, because school districts with higher autism rates tend to be concentrated in New York City and Albany, it's possible that these students have greater access to diagnostic services, leading to higher rates of diagnosis within the school district. So it's sort of chicken or the egg type of question, whether with this study, we're not really reflecting on causation, but just looking at correlation and patterns. But it is consistent with literature that not in the US particularly, but in some other larger cities that students with autism or children with autism tend to be concentrated in urban regions. Next slide. Research on autism diagnostic disparities among racial, ethnic, and linguistic minorities is continually evolving and changing. Historically, racial and ethnic minorities have experienced diagnostic lags in obtaining an ASD diagnosis when compared to their white counterparts. The findings from the study suggest that there are slightly higher representation of racial and ethnic minorities in New York school districts with the highest rates of autism. There are a few major limitations with this study, which I'll discuss. For one, because of the varying methodological and sampling techniques used to measure autism prevalence, such as the ADDM network, which is clinical, the National Health Interview Survey, which is parent report, but a more representative sample, and a national sample, which is great. And for the study, the DOE school district data. So because these methods vary, true ASD prevalence can be difficult to capture. Additionally, because we use school district data rather than individual level data, that also posed a limitation of this study. And just a few recommendations. Analysis of individual level data on a larger scale, i.e. national, would provide a more accurate portrayal of ASD distribution. Because delayed diagnosis among racial, ethnic, and linguistic minorities is such a pertinent issue, it would be beneficial to see how age of diagnosis varies among differing groups of students, including ELLs. Further research should be dedicated to understanding the unique needs and experience of ELL students, including consideration of home and language environment, as disparities still exist. Particularly because a lot of assessment tools are not normed to bilingual students. So I believe the current research says that while the racial gap is closing, that the language gap in autism diagnosis still exists. Next slide. But that's about everything. Thank you very much. And happy to answer any questions.
Is there any questions from the board that we'd like to talk to Katie about? And Alexia, I don't know if I can see the hand raising or questions. I don't know if there are any.
Maybe we can just chime in, Charlie. This is Greg Roberts from OPWD. I had a question for you, Katie. I found it interesting when you talked about the number of students in their drop off. There are more, 12, 13, 14-year-olds, which is fairly standard. I can see less at first as more people are diagnosed, then they, hop onto the radar screen, so to speak. But it seemed like there was a declining number at the age of 14 or 15. When just on the face of it, it seems like students start to graduate, 17, 18, 19 to 21. I could see that trickling down, but was there any thought as to why there was maybe a cutoff, or it started to decline at like 14 and 15 years old? Just curious.
Yeah, I was curious about that. Also, I wasn't I wasn't sure, especially between 18 and 21, if these were less. I think probably a better solution would be to look at the percentage. For this, we did the counts. So I'm just curious for maybe if there were smaller student populations, or if teens and young adults, maybe 14 plus, if there weren't as many enrolled in schools. So a limitation of the graph we provided is just that it offers the student counts and doesn't give the proportion per school district, but that was a very interesting observation. Great question. Thank you.
Hey, Katie, does the study also include those that are registered but homeschooled? I'm just curious to see the trend of those in this population that are moving to homeschooling.
Yes. So my understanding is that if it's not school districts, my understanding is that it's not just limited to public school districts, but also any type of special education school or students that were enrolled. Now we did this prior to COVID pandemic, so I think it would be really interesting to see how data collection may be changing among school districts now that if they're collecting information, if children are at home, if they're learning virtually, because I believe there has been some findings that that the shift to homeschooling and virtual education has had some negative consequences in terms of regression and socialization and things. So this I believe covers any child that is receiving special education services in New York State. I'm not aware currently what data the school districts are collecting on home education versus in person.
Okay. Well, again,
Dr. Yu has her hand up.
Katie, for walking us through the findings. I'm wondering if you plan to continue this line of research because in case you don't have nearly enough to do, CDC currently has an RFA out for the next round of funding for the Adams surveillance. So it may potentially be an opportunity for New York State to participate going forward.
Great suggestion. Thank you. Thank you. Yes, absolutely.
okay, if no other comments, Katie, again, thank you so much for this wonderful presentation. And we do look forward to hearing some follow-up on future research and studies.
Thank you.
All right, so we'll move on to our second presentation. And it's OPWDD's 2023 to 27 draft strategic plan. And we are seeking public input, encourage members to read the plan and make comments. And it is a densely written plan, but there's a lot there to be covered. And I believe OPWDD has put summaries up on the site. So really, again, I encourage those who haven't had an opportunity to review this to do so. So Dr. Jessica Pidgeon will be making this presentation. And Dr. Pidgeon joined the newly established Office of Strategic Initiatives at OPWDD in December as the Strategic Planning Director. In her role, she supports the agency and leadership in the 5.07 strategic planning process, including engaging stakeholders, drafting content, and evaluating agency progress on meeting its goals and objectives. Prior to joining OPWDD, Jessica worked at the New York State Developmental Disabilities Planning Council, where she led numerous federal work groups around strategic planning, evaluation, and data collection, and provided technical assistance to grantees and other state councils. So Dr. Pidgeon, welcome. And again, we're anxious to hear your presentation on this really important plan.
Thank you. Thank you for having me today. Excited to be here this morning. Hopefully you can see the PowerPoint presentation.
Yeah.
So as mentioned, my name is Jessica Pidgeon. I work for the OPWDD's newly established Office for Strategic Initiatives. We do a lot of different work under the what we call OSI internally, including the strategic plan work, which was just shared, and stakeholder engagement. So this morning, I'm going to do a very quick overview of the strategic plan for 2023 to 2027. I'll also leave time at the end if we have it for any, initial questions or comments, but I do encourage you to utilize some of our other opportunities to also submit feedback, which I'll go over in the presentation at a later point. So the 507 draft document, so it's our 2023 to 2027 strategic plan, also known as our 507 plan. 507 is a specific reference to legislation that requires us to submit this plan to the New York State Legislature. So you'll hear it referenced as both our strategic plan and our 507 plan. They are one and the same. So I like to kind of give that overview because some people know the 507 language, some people don't know what that means, but understand the idea of a strategic plan. So the document itself has a strategic planning input and data section, and I'll provide a little bit of an overview of what is included in that section. We also have a majority of the document, which includes the strategic goals and objectives that we've outlined for the next 5-year period. We have a brief evaluation section, a conclusion, and a substantial set of appendices at the end of the document. If you haven't had the chance to view the document yet or review it, I encourage you to do so. You can find it on our website at opwdd.newyork.gov/strategic planning. There's a lot of other good information around our strategic planning process on that page of our website as well. But like I mentioned, I will provide a very brief overview of the document today. I do encourage you to look at it if you get a chance to. There's a lot more content and specific activities and details in the full document. As was noted, we also have a plain language version of this document, so it's a shorter version, and the document is available in 10 languages, soon to be 12 other languages. So it should be accessible for anybody who's interested in viewing it. So for the strategic plan, to prepare for the plan, OPWDD invited input from a variety of different stakeholders in the spring and summer of 2021. This included self-advocates, family members, provider organizations, and others. We collected the feedback through a variety of different mechanisms or ways. We held 5 regional public hearings where we had over 100 speakers share their thoughts, concerns, and priorities for us to be focusing on in the next 5 years. We also had other meetings that we held with specific groups and communities, and received information and input from over 33 different groups through those means. This included, again, specific self-advocacy groups, family organizations, provider organizations, disability councils around the state, and also conversations with community groups and organizations that represent underserved groups. In addition to that, we collected email comments. We had comments from over 150 stakeholders that were unique or different from folks that we heard from in that 100 speaker spot in those 33 groups that I just talked about before. So we actually had well over 200 emails, but we note the 150 new people that we heard from in the presentation here. And then we have a Developmental Disability Advisory Council in New York State. They're a body that works alongside OPWDD, supports some of our work, provides suggestions and recommendations on the work that we're doing, and they have a legislative and statutory role in our strategic planning process. So they also submitted recommendations specifically to us for what we should be prioritizing in the next 5-year period. This section of the document includes Medicaid utilization data and staff stability data as well. We have recently released Medicaid data on our website, and we'll be updating that on an annual basis moving forward alongside updates on our actual strategic plan. On top of the Medicaid data and the staff stability data and all of the stakeholder engagement, we also looked over different national data and trends to see what that was suggesting should be some priorities or things we should be thinking about or focusing on in the coming years. Through all of that stakeholder engagement, you and other stakeholders identified the following key priorities for us to focus on in the next 5-year period. The first is addressing the disability/DSP workforce crisis that New York State is currently, in addition to the rest of the nation. We also heard from stakeholders that we should be focusing on improving our self-direction model of services, improving our housing supports and services that we provide, making sure that we're better supporting people with more complex needs, improving our use of data and our transparency with stakeholders around our data and services, and then identifying and supporting more opportunities for research of different programs and services across the state of New York. These were the ones that kind of rose to the top, but we did also hear a lot about employment, children's services, health equity, and also making sure that we're improving access to supports for those who come from underserved communities. Based on all of that input and the priorities that were identified, we've outlined the following 3 goals for our 2023 to 2027 strategic plan. The first goal is to support people in the most person-centered ways. The second goal is to promote practices that strengthen the workforce and infrastructure. And the third goal is to advance systems change and innovation across the state. I should note that these are numbered, but the numbers that are attached to them are no reflection of their prioritization necessarily. So we know that the workforce crisis is, a substantial thing that we need to try to work on and address. So even though it's under goal 2, it doesn't mean that it's less important than goal 1. It's just how we've kind of organized the document. So as I noted, goal 1 is seeking to focus on supporting people in the most person-centered and holistic ways possible. We'd like to improve the supports and services for people with developmental disabilities throughout their lifespan of all ages by addressing different gaps in services and ensuring supports are focused on individual need, that our supports offer choice, maximize independence, and also increase community integration. We'd like to increase opportunities for community integration and participation. We want to make sure that we're supporting the facilitation of self-determination, and we want to look at activities that improve social determinants of health. We also want to ensure that children, youth, and young adults receive appropriate and coordinated services within the context of school, family, and the community. We want to expand and improve services targeted for people with complex support needs, and that includes both residential and crisis services and our behavioral supports. And we want to identify and address gaps in services and supports that meet the needs of underserved, culturally and ethnically diverse communities across the state of New York. For goal 2, we're interested in finding ways to advance the OPWDD system, and this is by investing in our workforce, updating our service system to better support efficient service delivery, and increasing access to information. So we'd like to improve the recruitment, retention, and the quality of our direct support and disability workforce across the state. We'd also like to advance technology and our information infrastructure and explore approaches that increase the availability and timeliness of data, and to use that data to support our decision-making, to help monitor the performance of the services that we're providing, and to assess the quality of those services and supports. We also want to continue to promote opportunities like this and others for stakeholders like yourselves to inform our decision-making on an ongoing basis. We currently hold a lot of different groups and opportunities to engage with different stakeholders, and we want to make sure that we're being productive in those conversations. We're best communicating information and exchanging information with each other. So we're really looking forward to improving and thinking about our stakeholder engagement over the next 5-year period as well. Lastly, we're interested in exploring new approaches and opportunities that advance the system, reduce the complexity of our services, and improve the responsiveness of the system. To do this, we'd like to strengthen the quality, equity, and effectiveness of our supports. This includes our self-direction model, our competitive integrated employment services, the continuum of housing and residential options that we provide, and also our care management services. We'd also like to increase opportunities to explore and implement regulatory and policy changes. And we're looking at regulatory and policy changes that support greater flexibility, and also incentivize improved personnel outcomes. And lastly, we'd like to prioritize innovation. We're interested in evaluating our programs, conducting research, and developing more opportunities to test new approaches to our service delivery system. As I noted, there are a few other sections in addition to those goals and objectives, and in the full document, under each of those goals and objectives that I just reviewed, you'll also find a number of very specific activities, including a lot of information around how we're planning to spend our American Rescue Plan Act funds and how that's connecting with our 5-year strategic plan. So if you look at the document, you'll be able to see a lot more content and specific activities and examples of what we're planning to do around self-direction and around housing and employment and all of that. Additionally, there's the evaluation section. This section talks a little bit about how we plan to measure our progress on meeting these goals and objectives that we've identified for the next 5-year period, including how we plan to continue to engage with stakeholders in the conversation to hear about the work that we're doing, to see whether or not it's being impactful and, you know, the changes that are being made are being felt on the ground in a positive way. We'll also continue to look at and review national and state data to make sure that we're, you know, paying attention to what the numbers are telling us and utilizing that information in addition to what stakeholders are telling us to continue to evaluate our progress on the plan and whether or not we need to modify the plan. We consider the plan to be a living document where we can update it as needed, especially if something was to arise. You know, for example, something like a COVID, where, you know, things kind of can shift pretty dramatically in a short period of time. There's also a conclusion that talks about how we plan to update stakeholders throughout the year. We have a specific website, which is the one I shared previously, where we'll be providing updates on our strategic planning process and the progress of meeting our goals and objectives. And we will be having an annual report that's released to talk about that progress as well. And then there's an Appendices section, which has a pretty lengthy acronym and service terminology list. We also have included a detailed overview of all of that stakeholder input that I talked about previously, you know, down to what type of the activities we were holding, what people were saying, and you can kind of see a list of that and review that too. So overall, the way that we look at these goals and objectives for the 2023 to 2027 strategic plan is that we look at it as an opportunity for us to provide a roadmap for how the agency can stabilize our system and services in the short term, but also look at how we can lay out important research, evaluation, and innovation activities that will inform ongoing system improvements in the long term. We believe that the plan that we've outlined will help OPWDD alongside and in collaboration with our stakeholders to work together to achieve a clear and planned progress of on our systems reform and any kind of waiver reform we might consider, and that we'll move together toward a more person-centered, sustainable, equitable, and coordinated system of services for New Yorkers with developmental disabilities. Some of the immediate next steps related to our 507 and strategic planning process. We recently held 2 virtual public hearings in the beginning of June where we encouraged stakeholders to provide feedback to us on this draft document. We're also traveling around the state and holding in-person regional meetings. We've held a number of them already. We have a few more weeks to go where we'll be in some other locations across the state. In addition to that, we've recently announced 2 more statewide public online hearings that will be held. So we encourage you, if you haven't had a chance to participate yet in one of the virtual forums or in one of the in-person regional forums, to consider the opportunity to visit us at one of the upcoming regional forums or to participate in that virtual hearing, one of those virtual hearings that's going to be held in the future. We also are collecting feedback in written form. So we have a specific form, and I'll give the link to that in a second as well, where you can submit your comments on our draft plan. And there's also an email if the written feedback form is a less accessible option for you. Then we do have an email where you can submit your comments directly to myself and my team on the strategic planning side of things here at OPWDD. Once we have all of that input that we receive from stakeholders in June, July, and actually also in the beginning of August, we'll be updating the draft based on that information that's been shared. We already know there's a few sections that we'll need to update moving forward, so we're working towards that. Then we'll be sharing those updates and the new document, the final version, with the Developmental Disabilities Advisory Council so that they can review it, which is a part of their statutory role. Once we've done that, we'll finalize that document and submit it to the governor's office and the legislature by November 1. So as I mentioned, the written feedback, and also if I have time, I'll pull up and show you the next regional forums that are remaining that you can attend if it's in your area of the state. But first I'll talk about the written feedback. You can submit written feedback, like I mentioned, at the following link on this website, opwdd.newyork.gov, statewide comprehensive 507 plan. There's a specific form. The form asks you a little bit about yourself so we can make sure we know who we're hearing from and we're reaching all voices across the state of New York. There is a section in that form where you can just submit any kind of written comments, paragraphs, etc. So there is an open space for that. We do ask that you try to submit your written feedback to us by July 29th so that we do have an opportunity to review all of it, incorporate it into the updates that we're making on the draft plan, which we'll be doing in August. Again, if the form itself, doesn't work for you or might not be the most accessible option for you, we do also you can also submit and we'll receive emails at planning@opwdd.newyork.gov. If you can, just include like 507 or draft strategic plan in that subject line, so it kind of flags us that that's what your email is about. We'll read them either way, but it's just a little bit helpful if you do that. So that's the end. I am just going to pull up, see if I can do this quickly. Our 507. Can you see the regional forums? I can't see you if you're nodding.
No.
No.
Okay, well then, 1 second, I'll see if I can pull that up. Hopefully now.
Yes.
Perfect. So we've already held them in Plattsburgh, Binghamton, Queens, Long Island, Staten Island, and Albany. But we do still have a number of them left. So we'll be in Rochester and Buffalo early next week. We'll be in Syracuse in July 26th, Manhattan, Brooklyn, Bronx, and Westchester the first week of August. So if you're in any of those locations, we encourage you to come out and hear a very similar presentation again. But then also most of that meeting is actually hearing public comments from anybody who's participating. So we encourage you to do that. Come share your thoughts on the plan and let us know, what makes sense, what sounds right, and what maybe we need to improve and rethink moving forward. This website also, I'll just scroll up quickly, also has the information and links for those 2 additional virtual hearings, one on August 15th and one on August 16th that I previously mentioned as well. So that's it from my end. I'm going to stop sharing. And thank you again for your time this morning.
Jessica, this is incredibly encouraging and very exciting, especially the communication and transparency part, which I think is vitally important to communicate to the public on how successes are going. Is there talk when you decide to communicate the success towards your goals or reaching your goals? The plan is one big plan with a lot of objectives here. Are you going to break out that communication or that reporting by sections? Or are you going to break it, or is it just going to be as a whole and how the entire plan is doing?
Yeah, so that's a great question. We're still looking at, and actually I think the final document will look a teeny bit different visually too, but we'll likely do an overarching report that gets at all the objectives and the goals that we've outlined when we do that and provide those updates. But we can definitely consider different ways to communicate that and break that down, information wise, and present it once we have that in a more manageable way, if that's, helpful.
And just one other question for the board. Have you thought about also breaking up the goals? I'd be curious to see, I don't know if you're looking at it, if there's overlapping goals by different age groups, or if there's certain age groups that's much more specific to some goals versus others, which I think there would be. But I'm just curious to see if you're looking at it by age group at all, as far as when the stakeholders are making suggestions toward the goals.
Yeah, so we do have, like there's a specific objective around children and youth, but you'll also see, we're thinking about across the lifespan, so all ages and all the work that we're doing, and thinking about how we can best hear and engage and prepare the system for what's currently happening, but also what, the system may look like in 10, 15 years from now. So, we'll report a lot of the children and youth, young adult stuff under that objective 1.2, which is focused on that. But, I'm sure you'll see some other content throughout the document that speaks to different. So if we're talking about employment, that includes transition age and youth in addition to adults and stuff like that. So I'm not sure if that answers your question fully or if I'm missing.
No, that's a start. Yeah.
Okay.
Sure. Thank you.
Yeah.
Alexia, do you see any other questions from the board? Okay, so again, Jessica, thanks so much. I guess we'll be moving on then to the next part.
Great. Thank you so much.
Thank you. So, Greg, I know you want to give an update on one new law that's passed that's going to affect the board.
Yeah, thank you, Charlie. It's not quite a law yet. Senate Bill 8647 passed both houses of the legislature unanimously. And this has a direct impact on the board. As you know, the board currently has 9 ex officio members that are selected by state agencies. And there are 10 appointees of legislators. 2 are appointed by the governor and 2 are appointed each by the Senate and Assembly minority and majority leaders. So the legislation that just passed and was sent to the governor last week, so it's currently sitting on her desk awaiting her signature or veto, would require the politically appointed, the elected officials who have political appointments would be each granted 1 additional appointment, and each of them would be required to appoint a self-advocate. And to give you just a little more detail on that, I want to turn it over to board member Michael Gilberg, who this legislation is a result of his advocacy. And Michael, if you want to touch on the importance of this, and if you want to talk about how you got this done, it'd be great. Thank you.
Sure. Well, we have the self-advocate committee. One of the problems I found is most of the legislative appointments where it said a family member, or a self-advocate were appointing family members. And as I spoke to Assemblyman Santa Barbara, who originally created the committee, I said to him this was an ongoing issue, that in most cases, a family member was appointed and there weren't enough self-advocates. The self-advocate committee was created, but as I see it, that was kind of a creature of the board and not necessarily a member of the full board itself. Now I'm appointed by Senator Stewart Cousins to the full board, and I said we need to have both. There shouldn't be one or the other. So I asked Assemblyman Santa Barbara and Senator Mannion, and they put the bill in, and there was no objection to obviously changing it from self-advocate or family member to self-advocate and family member.
That's awesome.
It's a great job, Michael.
Thank you.
So, we're anticipating we'll have an answer for that within the next week or so. We don't speak for the governor. It's, of course, it'd be her decision and her team. But we've haven't heard anyone raise any objections so far. So we'll see how that turns out. And since we are a little bit ahead of schedule, Charlie, did you want to maybe have the members introduce themselves, since I think we made up a little bit of time?
Sure. So why don't we go around? Let me just see if I can pull up. Yeah, I'm having trouble seeing the names of those that are here. So maybe either Greg, you or Alexi can help me with that. We could just start around the table.
Yeah, I can do that, and we'll go alphabetically by the way they are listed here. Alexia Holden is OPWD staff member who helps put this meeting together. Alexia, did you want to just say hello?
Yep. Good morning, everyone. Happy to be here. Thank you for hopping on the board meeting today, and thank you to our presenters. Those were both great presentations. So yeah, thanks for your involvement in the board and continued engagement.
Thank you. Next, I want to move on to Salon Myers, Education Department.
Hi, good morning. I'm Salon Myers-Ruff. I'm the Deputy Commissioner for Adult Career and Continuing Education Services, which includes vocational rehabilitation. Thank you.
Thank you. Next, we'll go to Charles Massimo, who has been chairing today's committee meeting.
Again, good morning. Glad to be able to step in this morning. Thank you.
Thank you. Thank you. Next, we have Christopher Soriano, also State Education Department.
Good morning, everybody. I'm Christopher Soriano, Assistant Commissioner for the New York State Education Department's Office of Special Education. I oversee the implementation of IDEA across our public school districts, non-public schools, pretty much wherever students with disabilities are served. And I work closely with Salon. And great presentations. That I found the data one very interesting, and may, if possible, reach out to you with some questions.
Thank you. Next, we have Dr. Helen Yu from Institute for Basic Research.
Good morning. I'm Helen Yu. I'm a behavioral researcher here at New York State Institute for Basic Research, which is the research arm of OPWDD.
Thank you, Dr. Yu. Next, we have Dr. Jill Pettinger from New York State OPWDD.
Good morning, everyone. Jill Pettinger, Deputy Commissioner. I oversee statewide services as well as IDR, where Dr. Yu is. And again, appreciate the presentations today, the data presentation. Again, really interesting results. And I'm also wanting to talk a little bit more to Dr. Yu about what we may want to discuss further with you, and where we may have some intersects. So again, thank you very much.
Thank you. Next, we have Josh Mirsky, and we'll hear a little bit more from Josh a little later in the meeting today. Josh?
Everyone, just want to say it's an absolute pleasure once again to be here. And thank you, Greg, for the introduction.
Thank you. Next, we have Kristen Thatcher, who is a member of the Subcommittee of Self-Advocates, as Michael had mentioned earlier. Kristen?
Hello, my name is Kristen Thatcher. I am a self-advocate. I'm a lobbyist. I also work for AHRC. I don't know what else to say because I had done a lot. So, yeah.
Thank you. Thank you very much, Kristen. Next, we have Michael Gilberg, who you heard from moments ago. Michael?
Not sure what else I have to say, but thank you again. I already introduced myself.
All right. Wonderful. Next, we'll move on to Mike Tripodi. Mike. No, Mike, okay. Mike, if you wanted to hop on later, if you're unable to unmute, go ahead at any time. Next from Department of Health, Dr. Mila Harrison.
Good morning, folks. Mila Harrison, one of the medical directors in the Department of Health's Office of Health Insurance Programs, with a background in child and adolescent and adult psychiatry, as well as public health. It's an honor to be here. Thank you.
Thank you. Next, we have Rob Myers.
Hey, good morning, everyone. Rob Myers. I am actually on vacation, so if you hear boats in the background, that would be the water skiers that just went by. We're up on Lake Ontario. And I, in a previous life, co-founded a regional autism center in Central New York, have worked in both academia as well as the nonprofit sector related to autism for most of my career, although currently I'm the CEO of a network of hospitals in New York, Pennsylvania, and Hawaii.
Thank you. And next we have Vicki Haifa, I believe. Vicki, I didn't use your name a lot, last name, but Vicki is the Executive Director, I believe, of the Developmental Disabilities Planning Council.
Yep. Thank you. Happy to be here.
Thank you. And Charlie, that's everybody on the board members who are in attendance today.
Oh, great. Thanks, everyone, for taking the time early this morning to be here. Next part of the discussion, as Greg alluded to, we'll be hearing from Josh. This is pretty exciting, something we talked about months ago and now continuing And Alexia, I believe, is going to give us a little bit of an update on, or talk about neurodiversity flag contest idea and the next steps for us on the board to take. So Alexia?
Thank you. Actually, Alexia was feeling a little under the weather this morning. I'm going to pinch hit for her, and hopefully I can fill her shoes on this. But yeah, as Charlie had said, this is a pretty exciting thing. I want to, my role, I just want to talk about the structure of what we're going to do going forward, hopefully over the next 6 months or so. I will then turn it over to Josh Mirsky, who this was really his brainchild, and he's the driving force behind this. So he can talk about the reasons and what we hope to accomplish. So overall, what the board is going to try and do is see if the board can adopt a neurodiversity flag to represent neurodiverse individuals throughout New York State. Josh has done a lot of research, and there's nothing that quite fits this category yet, and we will let him talk about that. But how we were envisioning this is, starting today, we're going to put out an open call, and we're going to tap board members if you have any other ideas how we can get the information out there. But we would like people to solicit their ideas to the Autism Board and flag designs of what they think represents the neurodiverse community in New York and for the world. And we're going to try some various media outlets or whatever it takes we can take to get the word out there, to get people to solicit ideas. And when people do solicit ideas, you can go to the OPW, to the board's website, which is attached to the OPWDD website. That can be found if you just Google OPWDD or Autism Board. There will be an email address on there. And I was going to read that, and the email address that you would solicit the flag ideas to is ASD Advisory Board at opwdd.ny.gov. And that can be found just by Googling OPWDD Autism Board, and you will get there. Hopefully, if we get, we're hoping to have a number of submissions sent in between now and the next board meeting, which is tentatively scheduled, I believe, for early October. At that point, what we would like to do then is to, show the public the submissions that we've received, and then give instructions on how the public can vote. And what we would really like to do is to, put the word out to, we want a neurodiverse population to be voting. So we're going to try and find and get this widely publicized, hopefully. And if that goes well, hopefully we would then like to, announce or adopt it later on in the year, probably at the December meeting, hopefully. Before I turn it over to Josh, I see Chris Soriano from the State Education Department has his hands up. So Chris, did you have a comment or?
Yeah, Gregory, let me know if you're interested, but if there's some type of announcement on the flag contest, we can certainly put that out through our network of technical assistance providers and our family and community engagement centers that my office oversees. And, they're specific to special education. So we would get a pretty diverse population and hopefully get, increase the number of entrants.
Wonderful.
Yep.
Thank you. So with that, I want to turn it over to Josh Mirsky, who has done a lot of work on this. He's done a lot of groundwork, and he's out actually hustling up media attention as well. So without further ado.
Well, thank you. This has been about, probably a little bit over a year in the making. I know Greg could attest to that because the amount of emails I think I've sent to him about this is an insane amount. But yeah, I think this is very important for a couple of reasons. One being when I was first since they said, hey, we might want you on the board, and then I was pretty much nominated by different senators. I told people, hey, I'm going to be on the Autism Advisory Board, and not one person knew what that was. Not one person ever heard of it. And the people I told were parents of people on the spectrum, other government officials from state senate, all the way up to actually the United States Congress. And so I knew that we had a problem because the thing is, after 2020, obviously morale so to say, has been not at its highest point. I think it's safe to say. So, especially for people who already have a hard time, like folks, neurodiverse people, who like, I mean, it's. I think it's safe bet to say that we get like bullied more than other people, have a harder time, yeah. So we need something to help like raise that, like and everything to make them feel like better and like just make things better. So then I look and you see the pride flag, and that's a beautiful flag. That's an absolutely beautiful flag, and it's recognized everywhere. Everywhere you go, you see the rainbow pride. You see that pride, and you know what it stands for. And throughout history, flags are always big symbols. They bring up lots of emotion and stuff. It's always a rallying point. So I thought, we should have that because if we have a flag, then we could say, hey, that represents this. And did you also know there's an autism advisory board? Then more people would know. Then we would get more people watching this live, and we would get more engagement from the public. So then we would then be able to engage more of what the average New Yorker on the spectrum needs, and we would get a wider variety and more diverse people watching, so like large number. So this flag, I think, addresses a lot of problems, which I found from people not knowing that there's a board, what the board does, who's on the board, how to watch the board, get government officials, again, from the state senate level all the way up to United States Congress to know about it, to get the media to know about it, and much more. So I think this is actually of vital importance if the board to actually were to do our full potential. Because I really think, especially after an event like 2020, with all of the stuff which happened, it's needed now more than ever. So I think the fact that we are actually discussing it here on record and that we're actually going through with it is absolute massive step. And I'm just extremely excited for this thing to go forward and to see all the good it can do, and to one day see that thing waving on a pole next to the pride flag and all of that. I think it's going to be fantastic, absolutely fantastic. And I know personally, like, not to say names, but I have friends high up in ABC on executive levels, and they're very interested in this, by the way, too. So I think it's a safe bet to say that we can drum up media attention as this thing goes forward, as thing gets traction. I think there's a very safe bet that can happen. So this thing can really catch fire and go. And I think that's about all I have to say at this point about that. Greg, I'll get back to you.
Yeah, thank you very much, Josh. Are there any comments, thoughts from the board of how we can maybe reach out to make sure that we can get the most people possible involved with this? And Kristen, I see your hand is up, so please.
So I think we should go and talk to send it into the news. I think we should just do anything we can do. Get it on Facebook, get it on the news, get it in the newspaper, get it splurge it out. That's what I was thinking, because that's how people get their news anyway. And what this board will do, it will show other people with autism that they can achieve things. Right now, I mean, things got much better, don't get me wrong, but there's a lot more to do. And if we can show people with autism that they can achieve things by just looking at us, by the people on this board who has autism, and they can achieve things. That's what I think. So if we can show them, and they can contact us and tell them what they need to be fixed,
Yep.
and we can really help the people in our community.
So wait, so basically you're talking about increasing public engagement, like this flag being perhaps just a jumping point, and then from there increasing public engagement through social media?
Exactly. If we want to show people that autism can talk for themselves, and what you said about the flag and the board, not a lot of people know about this board. So we should have people with autism be able to contact us and tell us what issues are out there that we need to help fix.
Exactly. Yeah, no, I fully agree.
And Greg, is it possible for each board member to come back with 2 or 3 of their own ideas, solicit their own people, and then come back with ideas and try to narrow it down to maybe 3 or 5 choices, then go on a social media campaign to take a vote on the 3 to 5 choices that we've made and see where the most popular vote comes back at?
Yes, and yeah, and that's what we would, hopefully in this phase, the next few months, we'd like to solicit as many ideas as possible. It'd be wonderful if we could have, multiple flags to choose from, as you said, to narrow it down for a list where we can give some people options to vote. So, yep, that would be how we would want to proceed. Thank you.
And Greg, do we have any kind of time frame for the next phase of it? Is there any timeline, or we're just going to kind of keep it open until we get enough participation? Or
Well, we would really like the flag designs to be submitted to the board by the end of September. So we have approximately 10 weeks to try and generate some momentum, some submissions. That way, at the following board meeting, we could then put them up and then try and vote, up until December. So 10 or so weeks, hopefully, or a couple months of soliciting ideas, and then possibly 90 days or so to vote.
There's also one more thing about this, which I almost forgot. Thankfully, I just remembered. So also every April, right? I hear, because on social media, I look up I see a bunch of folks on Spectrum are always complaining about April. And at first I was like, why are you complaining about April? This is Autism Acceptance Month, where some people call it awareness, some people acceptance, but whatever. And they talk about how blues triggers them. So I looked it up, and and when I say so many, that's a huge understatement, folks. That's a huge understatement. Lots of folks on the spectrum hate that. They feel that a certain organization, which I think we can all know what I'm talking about, but just so I don't know, I don't want to get in trouble here. A certain organization which has a puzzle piece, they feel that has kind of claimed autism, like it belongs to them, and they say that during that month, everyone gives them blue, and they feel that it's not them, that's an organization. So by us doing this, it's also in a very real sense giving the community back their identity, saying, no, you're not owned by a non-for-profit, where doesn't belong to that, it belongs to the people. So, and that's a very real thing, which most people also do not realize, unless you're in the community. You don't realize that that's a very, very big problem, and that a large percentage of autistic people actually despise April. They just don't have a way to express it. But if you go online and you read comments and comments, it's sad. It's really sad, because these people don't have a way of expressing themselves, so they can't get it out. So then you see, for example, the lighthouse lighted up blue and all that, and it's not for them. They feel it's for an organization. So it's really sad. So I think this is really giving it back to the people. So this is also, that's another reason why I think this is imperative that this gets done.
Yep. And I just want to add one more thing too to the public and people that are watching. And the idea of the neurodiversity flag is actually a little bit beyond autism. It's to people with other, neurodiverse individuals. So it hopes to represent a little greater community than just the autism community, because many of the issues, needs, concerns, and wonderful contributions that people make across the neurodiversity spectrum.
Exactly. Yes.
Right. All right. So more to come on that. I guess, Greg, since Alexi's feeling a little under the weather, you're going to take on the next part about talking about meeting formats going forward.
Yes, I will. And this is to let the board members know, as well as the public. We had been sort of discussing how do we get sort of back into the swing of things after COVID. Originally, the board had been meeting in person. That was sort of nixed by COVID, and then now that things are going back, I wouldn't say COVID is gone, but I think we're trying as a society to adapt and live with it as best we can. It's our understanding that the laws are changing regarding public hearings and public meetings, and this is an official government body. So it is likely that we are going to be moving back to in-person meetings. We're just trying to see how the law and the regulations are going to work out on the new requirements for public meetings. So there's going to be more to come, board members there, but I just want to let the public know and assure the public that these meetings will continue to be broadcast live as they had been prior, so that there'll still be public won't have to travel, just possibly the board members will. So I want to put that out there, and we'll have more information coming out to the board, as probably in the next few weeks as we try and start getting the next few meetings scheduled.
Well, certainly looking forward to my trip to Albany in December, Greg.
Ditto. I miss going to places, and I miss being able to meet everybody in person and talking in person.
All right, so Greg, do we want to open it up to the public now to see if there's any questions, comments?
Yep, and Josie, if you're quick with the unmute button, if you'd like to explain the process to people, how we can make this work.
Okay, so if you are a member of the public and you want to offer a comment, it's not a question and answer period, it's more of just a public comment period, you would want to raise your hand. I will then call on you, I'll unmute your mic, and you get a couple minutes to speak. We already have someone with their hand up. We have Maggie. Maggie, you're now unmuted. I sent the request to unmute. You can unmute yourself and speak. Okay, let's go on to the next one. Ruth Ann. You're unmuted. You can speak.
And like that, I appreciate what you were saying, and I understand you're on the board, so you got to be careful with what you say. But flat out, a lot of autistic people see the puzzle piece and Autism Speaks as a hate group, and so that's kind of what he was getting at too, just to make it extra obvious. Now to my other topics, I am been really talking about this for a while, but I really, really want the Office of Mental Health and OPWDD to work together a lot more to help improve like mental health services for autistic people, because it's quite ridiculous that that like a lot of therapists are not educated on autism and well disabilities in general, or even like crisis call workers, like if they're not educated on autism. Like I've literally had one that flat out made things worse because they were not trained on autism, and I think that could be a very simple like thing to fix. Like there's help for like veteran specific crisis lines for that, or like LGBTQIA plus. There should be something for autistic people too, because frankly we have a very high a lot of us have a lot of mental health problems. Then like still a lot more housing. And then I'm never gonna stop on this rant that OPWDD needs to change the adaptive functioning score, because for people like myself, that's adaptive functioning score is 4 points too high. I get zero help from the state, no help at all. But it clearly shows my score clearly shows that I still have a lot of struggles and need help, but the state can't provide me any help because the score is the way it is. So I just don't want, I know there's a lack of funding and all this stuff, but I just don't want that to get lost of all the people like myself who are just lost and can't live independently because I can't get any help. Okay, thank you.
Next, we have Zarifa. You can unmute your mic. You're set.
Morning. Can you hear me?
We can.
Okay. I work at a school. First of all, good morning. I work in a middle school, and I was interested in the neurodiversity flag information, but the gentleman who was explaining it was sort of breaking up. So if you could provide that information again, I'd greatly appreciate it. Thank you.
Yeah. Oh wait, Greg, you were.
Yeah, no, thank you. If we hope to put some more information up on our website, but just to summarize, we're now soliciting flag designs to represent the neurodiversity community. The board will be accepting submissions through September, at which point we hope to take the submissions and have a public vote on that. But we are hoping in the next week or two to have more details up on the website. And certainly if you wanted to email the board, we can email you back all that information as soon as it's posted. But thank you very much for your assistance and help getting the word out.
Thank you.
Next, we have Matthew. You can unmute yourself, Matthew Zeidman. Okay, we're going to go on to, oh, bear with me, my computer's hiccuping, of course. Oh, Matthew, you're unmuted. Go ahead.
Thank you. My name is Matthew Zeidman. I'm an autistic New Yorker. I just decided to make a public comment today after researching the activity of your board, your advisory board, over the past couple of years. I have to be honest and say that I was really horrified to learn how your advisory board has really acted as an uncritical cheerleader for applied behavior analysis, or ABA, otherwise known as autistic conversion therapy. ABA was invented by radical behaviorist O. Ivar Lovaas, who also invented gay conversion therapy. Lovaas went on record claiming he didn't believe autistic individuals were fully formed people. He believed he can make autistic people, quote unquote, indistinguishable from their non-autistic peers by rewarding and punishing them, much in the same way that B.F. Skinner got rats and pigeons to do what he wanted to do by administering food pellets and electric shocks. While most ABA practitioners today will swear up and down that their industry has moved away from Lovaas's cruelty, if they even acknowledge his cruelty, this doesn't change the fact that currently ABA practitioners aren't required to take even a single course on autism or how an autistic person's neurology differs from that of a non-autistic person's. They don't believe an autistic person's feelings or thoughts can be objectively measured, and therefore such feelings and thoughts don't matter. All that matters, in their opinion, is that through punishments and rewards, they can coerce autistic people into masking and into unquestioning compliance. They believe autistic people should accommodate society rather than the other way around. A 2018 survey found that autistic people exposed to ABA were 86% more likely to exhibit symptoms consistent with post-traumatic stress disorder. And when victims of this conversion therapy speak out, usually when they reach adulthood, about how they were traumatized, they're basically gaslit. They're told that they experienced old or bad ABA. They're told that maybe ABA wasn't right for them. They're told that they can't prove ABA is what traumatized them. They're told they're lazy and just didn't like that ABA made them, quote, work hard. Instead of cheerleading for these conversion therapists, your board should be pushing legislation that would actually benefit the autistic community. A good example being Andre's Law, which is New York State Senate Bill number 8935, which unfortunately was pulled from the Senate voting calendar on the last day of the legislative session. Andre's Law would effectively defund the Judge Rottenberg Center, an infamous facility located in Canton, Massachusetts, whose ABA practitioners still utilize powerful, debilitating electric shocks to modify the behavior of their autistic and other disabled residents. Unfortunately, through a loophole in the law, even though what they do would be illegal if they did it within New York State borders, the state as well as local school districts are still required if a family, for instance, of an autistic individual decides that they want that person to go to the Judge Rottenberg Center and experience these electric shocks, the state or the local school district have to reimburse the Judge Rottenberg Center. So I strongly advise the board to push for the passage when the legislative session begins again in the fall for Senate Bill number 8935. In closing, ABA is not science, it is pseudoscience. And I'd ask you to please stop allowing industry lobbyists with a vested financial interest in the expansion of ABA to dictate state policy. Thank you.
Next up, we have Laura. Laura, you can unmute. You're unmuted. You should be able to speak.
Someone has severe. Oh, sorry.
We can hear you.
Oh, okay. So I was saying I wasn't going to comment about this, but my son has severe autism. And when he was younger, he had self-injurious behavior, and ABA has been beneficial for him. And I am sorry to hear about people who didn't have a good experience, but I know it has benefited many children. So I guess maybe it needs to be better regulated. I did want to talk about, or just make a comment, I guess, about the data, where it seems the elephant in the room is why, why is the prevalence increasing, and what's going to be done about it? Because I think it's wonderful in seeing Josh and Kristen, and you all have jobs, can be very articulate, doing amazing things, but there's also a subgroup of people with autism, like my son, who's in his room all day, and he doesn't have a job. He's 20. He's not in school. His behavior is severe enough that he can't go out and, do a lot of things. So I think to do more research to see, why is this happening? Why is this increasing? Because at some point we see the numbers going up, and something needs to be done. I don't see how this is going to be sustainable as far as services. You think you've got to run out of money if it keeps, in JAMA, it said, it's now 1 in 30. So anyway, I don't know if that's something that the board is discussing as far as the increase in autism. But I think it's really important to figure that out. Anyway, thank you.
Thank you, Laura. So this is Greg. I do just want to address what you had mentioned. It's very timely. So we had recently posted on the board's website a report drafted by OPWDD and a number of our sister agencies, including the State Education Department and the Department of Health, as well as OCFS and OMH, on projecting the costs of providing services to people with autism out for the next 5 years, as well as using baseline projections to see how how the autism rates are rising in New York. And we may very likely have a presentation on that report in the next meeting. We thought about having it here, but the 507 plan and certainly Ms. McGrath's presentation were very timely and important. But there is information on the website. A report was just issued. And the data does back up what you're saying here in New York. It matches nationally. And I believe that at the moment, OPWDD, about 23% of the people served by OPWDD have a diagnosis on the autism spectrum disorder. If the trends of the last 5 years continue, that will be up to about 29% or so in the next 5 years. Mostly the explosion of autism, but there are a few developmental disabilities that are becoming less prevalent in the system. So I just want to put that out there for the public that information is available, and the New York State is looking seriously at how are we going to deal with the future rise of people. So thank you.
Next up, we have Marcia. Marcia, you can unmute.
I was wondering when the people that are flies on the wall of this board meeting will be able to speak. So, and thank you, Laura. You are in good company because my son is also in that subgroup of individuals with severe autism, which they're not being addressed. It's like we don't, I feel like our sons don't exist, and there has to be more done. Now, my son was living on Long Island. Long Island has failed him because 7 years ago, they all said no, all the children's places. Now he's 20, and now he was screened by 5 places that declined him. And you're supposed to be Office of People with Developmental Disabilities. 1 place screened him, granted it was over COVID, virtually. The other places did paper screenings. I need to know how my son is going to get to Long Island when these people, these places, these agencies can just discriminate within the discrimination of disability. So they are taking, now I can't prove this, but it's a self-serving business bias. They're taking individuals, kids that have autism, but it's not as severe. So I want to know, what about my son and all the other sons and daughters that need housing and should be back in their home district? They should be able to live on Long Island where we live and we pay taxes And these agencies need to be told, no, you need to support them. They can't just pick and choose within the disability. Thank you.
Everybody, can you hear me now? Thank you. It's something interesting with WebEx because when I'm doing this, then I'm losing your audio. But anyhow, I'm seeing the interpreter doing it. Good afternoon, good morning. My name is Paula Jordan. I'm the director of one of the federal funded parent centers in New York City, Synergia, and we support families and self-advocates to navigate the special education programs and systems that we have in the city. I'm very thankful for the information that we have today in terms of what's happening with education. But there is something that I'm also a parent, by the way. My daughter, she's autistic, and I have a niece and a nephew. So it is personal for me. I think it's time for you guys as members of the board to have a moral responsibility to really pay attention to what families are saying about autism. We need to really keep an eye on what's happening with profound or severe autism. It cannot be in the same category as individuals who are able to communicate with words, right? Like my daughter, I am not talking on behalf of her. She's fine. Programs and services that has been in place for over 40 years are making this possible, right? But right now, we have a moral responsibility, a legal responsibility to really start looking into see what we're going to happen, what we're going to do. Right now, Mr. Roberts, you're sharing data about the projections that we're going to have in the state. That is worrisome. There is not enough as it is. I just cannot imagine what's happening in the future. The other part is that I'm seeing that is very concerning to me is representation. I'm not seeing the multicultural families that you need to have here. There is not equity right now. What are you guys are doing to bring and to intentionally include Spanish-speaking families, Asian American families, Korean families? Autism does not discriminate race, social status, and you can see that here in New York City, when you see in terms of density. What are you guys are doing to do that? I personally not seeing that much, with all due respect. It's not enough to post a report on your website when many of those families don't even have access to the internet. This is something that is proven record out there after COVID. You can see the statistics. What happened when you're thinking about rural families or families who have the 200 minutes on their smartphones and they definitely need to be here, but they're not. We need to talk about and connecting that information and that data with the new generation of individuals have been diagnosed every single day. We're talking about hundreds and hundreds and hundreds. The other comment that I want to make to you guys is here in New York City, the New York City Council provide funding for organizations like the one that I'm part of, and we have programs for people with autism or autistic individuals. Why we don't know about you guys? What are you doing to reach out to those organizations beside the education through the New York State Department of Education who are supporting autistic individuals? We want to collaborate with you guys, but it's hard when there is no intentionality for you to go ahead and say, hey, this is who we are, this is what we're doing. We want you to be part of this. I think this is a missed opportunity that you can change very quickly for your next council. You can probably create a task force group to identify who are the stakeholders outside OPWDD. OPWDD is not all. Department of Education is not all. Remember, there's always a group of people that are going through the process of identification. Many families who do not speak the language English, they are the one who's not getting access to Albert Einstein, to Mount Sinai, to Columbia University. So we need to talk about that. Thank you so very much for the opportunity, and I hope that I can continue participating in your future boards meetings. Thanks.
Yep. So thank you. This is Greg Roberts again from OPWDD. We appreciate those comments. This is a point of information. I wanted to let you know that within the last 3 weeks or so, there was an announcement made by the governor that OPWDD has entered into a $10 million contract with the University of Georgetown to really work out over the next number of years, improve our diversity, equity, and inclusion efforts. Exactly what you had said we need to target to. I think that the governor agrees, and the OPWD. And we are going to try and put forth, a very serious concerted effort with some of the top experts in the world on diversity, equity, inclusion, and how we can improve our system to ensure that we reach everybody in all corners of the state. So thank you very much.
Next up, we have Molly. Molly, you can unmute.
I wanted to say, first of all, this is the first time I've ever joined this board meeting, and I've heard some of the comments about people not being aware that this board exists. And I am a parent of a child with autism, and I just happened to stumble upon the board meeting notice yesterday in an email that I got and said, oh, I want to be a part of this. So, the message isn't getting out to families consistently. So, and I also wanted to piggyback off of some earlier comments. I know that there was a caller who spoke up about not having a score on adaptive functioning being too high and not being able to receive services because of that. And I'm hearing other people saying kind of the opposite of their child is so severely autistic that there isn't any services. And it seems to me like there's this middle group of people with autism who are eligible for services, and that on either end there's a lot of deficits. And my daughter falls into the end of she is probably would score too high on an adaptive functioning scale to access services through OPWDD. However, there are some deficits that we need help with. One of the areas that has been a really big struggle is with schooling. She's in public school in the Albany area, and they haven't been able to program for her. She requires academically, she's at Regents level courses, but really would benefit from a smaller class size. And there just wasn't the programming for her. And I was actually told by a parent advocate at one point when I had reached out to them for support, and they said, you know what? You're better off homeschooling your child. There just isn't appropriate services in your district for this, for your child. And that to me is unacceptable. She's bright. She's got a lot of skills, and she's not a behavioral challenge in the classroom. There should be a way to program for her around her autism diagnosis. And so I see some deficits there that I just wanted to bring to light as well.
Let me just say, because I'm a special ed attorney, that sounds like something that needs a special education attorney. If you're not getting services from the school district, that's already required by law.
Next up, we have Tracy. Tracy, you can unmute. Okay, next we have ASGCR user. You can go ahead and unmute.
Schweig, I am the Executive Director of the Autism Society Greater Hudson Region. We represent 21 counties in New York State of families, adults who are on the autism spectrum and impacted by autism. I wanted to share a story of a young child that we tried to assist. And it's not just this young child, but it is the occurrence of individuals with autism who are being housed in emergency rooms and hospital settings. I'm going to share one particular story, but there are many more, and we had some great involvement with mental hygiene legal services. This 10-year-old young girl lived in the Albany area and was housed in Albany Medical Center for about 3 months. Great arguments between the school district, OPWDD, OCFS, every system was involved. The inability to find a bed for this 10-year-old with severe autism was so astonishing that OPWDD is not addressing planning, or it does not appear to be, for children with severe autism, adults with severe autism, And one of the reasons we couldn't get her out of the hospital was because there was an adult bed blocker, and I'm sorry to use that term, but that is what we call it in the system, an adult who could not find another bed, therefore blocking an appropriate bed for a 10-year-old student. To have a 10-year-old child living in a hospital for close to 90 days, mom had to give up custody of this child in order to get her the services that she needs. This is unacceptable. I am also the parent of an almost 35-year-old individual with autism who has more of an autism level 1 to 2 type of autism. The planning for the future of our children and families, those who have more mild autism who are not eligible for OPWDD services, those who have more significant autism that are winding up in emergency rooms and hospitals for weeks to months on end, is unacceptable. I have heard nothing from this advisory board regarding this issue. I do not hear any planning for these children and adults, whether they are on the mild side and can't access OPWDD services, or they are on the severe side and can't get into beds that they desperately, desperately need. We had months and months and months of meetings with representation from I don't think there was an agency that was not represented of the O agencies and beyond for this 10-year-old kid. I would like to know what OPWDD's plans are for cross-systems kids and what the plans are for building more appropriate residential options for children, and how are you going to move adults out so that they are no longer blocking beds for kids who absolutely need these services.
Okay, next up we have Jennifer. Jennifer, you can unmute yourself.
Something that's already been stated several times. I am a provider in the OMH system in Monroe County, and I have been for about 20 years. And I'm sure that you can imagine that there's been some crossover where I have worked with individuals who have been more suited for the OPWDD system. So I am aware of the system and how to get people into it. I also happen to be the parent of a child with autism who is 19, and I never heard of this advisory board before. I stumbled across this, I think on Facebook or LinkedIn, some social media, about this meeting today, and it was my very first time hearing about this. So we definitely need to do some more work getting individuals and families involved and getting the word out across the state that this exists.
Those were all the hands I had.
All right. So Greg, do we want to set up the next meeting? But certainly thank everyone's comments and passion and insight to things that are important to them.
Yeah, thank you, Charlie. Word out very shortly on the next meeting, and so that everyone will hopefully have time to to plan their schedules accordingly. And I think Josh Mirsky has been very prodding the board to take more actions and to help get the word out there. And he's been communicating with the OPWD's communications department. And we do hope to do more on that in the future. So thank you very, very much for the comments. I'll turn it over to Charlie to close the meeting.
Well, again, I would really like to thank everyone, especially Katie and Dr. Pidgeon for their presentation, and for Josh, always for your input and passion on getting this neurodiversity flag completed. Again, I'd like to thank everyone for the time. This is some great work we're doing, and I think we still have a lot of work to do. And again, very excited to be part of this board and be associated with everyone on this call. And certainly hope everyone enjoys the rest of their summer and look forward to getting together, hopefully in person, for our next meeting.
Thank you.